Alrighty, this will be video number 8, covering chapter 8 of the Spark book, titled Hormonal Changes, the Impact on Women's Brain Health. So, as always, general introduction, point number 1, point number 2, and point number 3, as well as an application. So just as a general overview, point number 1 I have is physiological occurrences. Point number 2 is exercise is a tool to reduce physical symptoms of PMS. And then finally, point number 3 will be exercise and the mental symptoms of PMS. So, as a general introduction and as a kickstart to the introduction, the book states that hormones have a powerful influence on how our brains develop, as well as our feelings and behaviors and personality traits throughout life. So that's just a general introduction to hormones. But more on this, exercise is particularly important for women because what it does is it tones down the negative consequences of hormonal changes that some experience, and for others, it will actually enhance the positive. So overall, exercise balances the system in terms of women, both on a monthly basis as well as throughout each stage of life. So monthly basis being the menstrual cycle and throughout every age. Something that also, as a general introduction, is something that absolutely baffled my mind when I read it. The average woman has 400 to 500 menstrual cycles in her lifetime, each one lasting 4 to 7 days. If you add them all up, it adds up to 9 years of menstrual cycles. That absolutely blew my mind. I never grew up with sisters, and my mom was not open about this at all. So when I read that, it was respect for women. Okay, going on to point number 1 now. The physiological occurrences. This one's going to be mostly focusing on estrogen and progesterone. So for women, the cycle begins with the hypothalamus that prompts the pituitary gland to secrete hormones called gonadotropins, which we know as the sex hormones, which travel to the ovaries and trigger the mass production of estrogen and progesterone. Estrogen peaks 5 times its baseline level just before ovulation, and then follows an up and down pattern for the next 2 weeks leading up to the period itself, after which it will even out. Then progesterone kicks in. It begins a kind of a fitful rise after ovulation to about 10 times its lowest level, and then it will peak just before menstruation. So that was estrogen and progesterone. A little bit more on pregnancy and menopause. The book stated that during pregnancy, estrogen will skyrocket to 50 times normal levels, and progesterone increases tenfold. But then also during menopause, both hormones decline until they nearly disappear altogether. This kind of is a segue into point number 2 here. Exercise is a tool to reduce physical symptoms of PMS. Before we dive into that, the clinical definition of PMS, or premenstrual syndrome, is physical and emotional symptoms experienced days before a woman's period. This results in mood swings, cravings for food, and depression, and probably about 150 different symptoms covered in this book. Exercise may not be the only answer when it comes to PMS, as we stated in class, especially with other topics, but it can drastically reduce the symptoms and give you a better handle on a part of life that feels beyond your control. So, i.e., this means a lifestyle change, and that medication might not be entirely necessary for some people. One survey of more than 800 women found that at least 50% of them used exercise to alleviate the physical symptoms of PMS. In addition to reporting less physical pain, the women who exercised scored better on concentration, mood, and erratic behavior. So, just based on this study, it might offer another suggestion to work out before and possibly during menstruation as well. So on to point number 3 here, exercise and mental symptoms of PMS. So perhaps what the book stated is that there's really not a whole lot of research here, but perhaps the best study on this comes from Duke University in the late 1900s, with a small group of middle-aged women, which were pre-menopause. The study compared how aerobic exercise and strength training affected PMS symptoms. This is right in my wheelhouse, and my application will show this. Each group trained for 1 hour 3 times a week. The 12 aerobic women did 30 minutes of running at 70 to 85% of their aerobic capacity, and then the other 11 women studied used weight machines for supervised strength training. Both groups' physical symptoms improved, but the runners, i.e. the aerobic activity, improved significantly more when it came to the mental side. They had a checklist at the end. They felt better on 18 of the 23 measures given. But most significantly, of these 23 measures, the most significant of them were depression, irritability, and concentration, which most of them felt improved tenfold. One explanation could be that exercise increases level of tryptophan in the bloodstream, and then thus concentrates the serotonin, and thus concentrations of serotonin in the brain. But it also balances dopamine and synaptic mediators such as BDNF. So, as a general application, the information provided in Chapter 8 was obviously applies more to clients who are women. But for instance, from the perspective of a future bodybuilding coach, we'll take it. If I ever worked with a female competitor who experienced PMS or even female athlete triad difficulties, for whatever reason that I know, I may be able to implement a little bit more cardio rather than weight training for the week previous to starting their menstruation to reduce side effects as stated in the book. Also, a little bit, maybe taken a little bit further, if I ever work with a female athletes that are enhanced athletes, i.e. meaning they're using pharmacological agents to attain some of their size, then understanding female sex hormones and how they may react to specific pharmacology and how it also relates to their menstrual cycles is absolutely a part of my job.